Good afternoon, everybody. Chris Wilson with Modified Independence here with another segment of 7 Minutes for Seniors. I am joined today by my good friend Lucie Browder. I knew you with a different last name when I first knew you
Breaking
14
news.
years ago.
I know.
Yeah.
Crazy.
For people that don't know, Lucie is the reason that I got into home health care. And if I hadn't gotten into home health care, I probably wouldn't be sitting here with you guys right now in this capacity. So I owe my healthcare career to you.
You're welcome.
I'd probably be schlepping it in a skilled nursing facility doing exercises with
We're full circle now.
ornery people. Yeah. So 7 Minutes for Seniors, Lucie Browder with Mobile Medical. Mobile Medical, we refer to them quite a bit, and I'm going to let her tell you all about them. But before we talk about Mobile Medical, I want to introduce you to people. So can you tell me about you?
Yeah, absolutely. So, hello, everybody. Lucie Browder. I just got married in May. Before it was Lucie Porchot, or a lot of people would say Lucie P. And I have been with Mobile Medical almost 2 years now. I started my journey in healthcare in 2000 at St. Vincent's Riverside.
Oh, wow.
So I started in their billing department for the lab, and then moved over to the case management department.
Okay.
And I worked there for 10 years, and then was with workers' comp for 11 years before Mobile Medical.
Workers' comp is a tough one.
It is.
Yeah.
But what I really learned through both is that I really love the care management aspect and connecting folks with resources and working with families. And it's just more of a gift than anything else to be in this industry.
Absolutely. And so talking about Mobile Medical, I have to, in full disclosure, we are at an assisted and independent living facility that's very near to my home. It really kind of highlights the whole idea of Mobile Medical. She's wearing the Mobile Medical colors, right? So we are coming to you from Benton House in Orange Park. It's a wonderful facility. We're actually in one of their model apartments right now, sitting on their super comfy chairs, doing this, right? So that highlights what Mobile Medical is all about, right? So tell everybody about Mobile Medical and the services that they provide.
So Mobile Medical is a full service primary care practice that cares for our patients where they live. So a lot of our folks are in beautiful communities like Benton House and other assisted living and independent living facilities all throughout Florida. In addition to that, we also have our home patients as well. So we can be with them in their homes or as they transition through senior living communities, even through to memory care. We are throughout the whole state of Florida, and we're really passionate about providing proactive care to our folks. We do see adults. Our primary patient population are our older adults, our seniors, and we can do everything that a primary care office can do in the comfort of their home. So imagine instead of waiting in a waiting room, you're waiting in your home, in your apartment. And then in addition to primary care, we also facilitate labs, x-rays, orders for therapy, skilled nursing. And then we also have behavioral health, and we have pain management that we can do. And our services are covered by most insurances.
Which is awesome. And being a person who's worked in home care for a very long time, I've run into a lot of your providers in the home, and that's always fun to see. I always think of your service kind of like Little House on the Prairie, right? When Michael would show up with the bag, right? And he'd sit on the bed with the kid that got bit by the porcupine, and have these these homeopathic remedies and everything like that. I love the fact that you go directly to, especially a lot of our homebound patients. They're not getting a doc in a box with a tablet, telehealth style. your providers are seeing the environment that
Mm-hmm.
your patients are living in,
Yeah,
which is very critical, because if you don't know what they're living in, you don't know what kind of community resources they need to be provided.
absolutely. And that's kind of some of the biggest things, uh, you know, the education piece, the being proactive, having the access to see what's going on with your medication. Show me how you're storing it.
Yeah.
How can we help with that piece of it? And then because we are in their area every week, they can receive appointments pretty timely.
Mm-hmm.
But if something comes up, even outside of those followed up appointments,
Mm-hmm.
we actually do have a nurse practitioner available every day for telehealth when needed,
Mm-hmm.
when we can't be there in person
Right.
too. But we really understand the value of that face to face and making the access of getting the care as easy and seamless as possible.
Absolutely, absolutely, and we recommend 99% of our patients to go to to go to you guys or other. There's a couple other providers in
Mhm.
the area, but for the most part, because I know Lucie,
Yeah.
and and I know that they're going to get their patients taken care of. We refer quite a few people to you through all the different programs that my company's been fortunate to be involved in, because a lot of times we find these people. And their primary care physician in the office has no idea that they're dealing with the issues that they're dealing with. So
Yep.
it's really beneficial to get you guys into the home. I remember, uh, boy, that's loud. I
Hi.
remember one time Jackie went into a home and the lady opened her cabinet and there's 65 pill bottles in there.
Mm-hmm.
And she went back to the chart that we were sent by the doctor, and he had 7 or 8 medications on the list. And when you get a provider in the home, you might catch a glimpse of something like that and
Mm-hmm.
really be able to get ahead of a situation
Absolutely.
before you get behind. So um, do everybody a favor
Mm-hmm.
and tell them how they can get a hold of you: website, email
Yeah,
address, phone number,
absolutely.
smoke signals, however.
So we have a couple of different ways. For me in particular, you can call me or text me at 904-451-4844. Our mobile medical website is www.mobilemedicalnow.com. We also have a Facebook page with the same name. And then our office number is 904-570-9404. And if you wanted to email an inquiry or referral, that's referrals@mobilemedicalnow.com.
Awesome. Thank you so much, Lucie. I appreciate
Absolutely.
you for being on. We will see you guys again tomorrow for 7 Minutes for Seniors. I'm Chris. This is Lucie. Y'all have a great day and be safe. Thank you.
Bye.